Hi there and welcome back. You are listening to Naturally Recovering Autism, and I am your host, Karen Thomas, and we're coming to you live from the Global BBM Network and TuneIn Radio. And if you've been with us for a while, this is about offering you natural resources to help you recover your child from their symptoms of autism. And that can be the definition of recovery is to regain health. So in any physical, behavioral, emotional way that we can help you to improve your child's outcome, that's what I offer these free resources for you weekly. And today we have a very special guest once again, and a really valuable topic that I know is affecting all of you. And this is about biosystemic dentistry. Now, I'll start off real quick by saying we're going to give a lot of valuable information in this show. And if you're driving or you're at work and you're listening, but you can't write it all down, don't worry, because everything we discuss will be on the page at naturallyrecoveringautism.com under Biosystemic Dentistry. So you can go there for all the links, anything we talk to. So again, biosystemic dentistry is exactly what it means, biological systems. So all of the systems of the body, the organs and everything in their relation to the mouth. And this is about learning what you can naturally do to both treat these issues and prevent further issues from coming up in the future. And our guest today is Dr. Panahpour. Dr. Panahpour is the most experienced holistic biological dentist in North America, practicing 100% holistic biological dentistry since 1993. He's known as the world's most experienced dentist for detection and removal of root canals with infection and for cavitation surgery at the tooth extractions. And we're going to explain all that, don't worry. Dr. Panahpour is a frequent speaker at holistic dental conferences and at naturopathic medical schools. He has documented patient cases in his book, The Good Dentist. He has more than 150 advanced continuing education courses on his CV, dozens more than any other dentist in the state of Washington. And Dr. Panahpour has recently moved his practice from Santa Monica, California to Bellevue, Washington, and patients fly in from all over the world to see him for his treatments. His greatest desire is to educate the public about the need for holistic biological dentistry, free of root canals, safe tooth extractions, and have an approach that encompasses the patient's diet, immune, and structural integrity of all the energetic alignment, as well as all the traditional treatments. He did his undergraduate studies at the University of California, Los Angeles, and obtained his degree of doctorate at the dental surgery at the University of Pacific in California. His degree, after graduating with his degree in dental surgery, he obtained further education at the New York Academy of Medicine. And without further ado, I would like to say hello. And again, thank you for being here today. I appreciate you giving us your time. I know you're a busy man.
My pleasure. It's an honor to be on your show.
And you have so much value to offer people, and especially parents of children with autism. So what I think we should just jump right into, why do so many children, well, people in general, but why do so many children, especially with autism, have so many issues with their teeth and problems in the mouth? What causes that originally?
Well, it happens on different levels. If I would have to make you a list, I would start with the number one, the biodome of where they live. That would be number one. And by that, I mean, excuse me, and by that, I mean really keeping a house germ-free as much as possible. I have visited a lot of different residents where I see the kids playing outside in the park, running around, and then coming home, and they don't take their shoes off. They use the same shoe to walk all over the carpet, jump on the couch, jump on their bed, or families that have cats and dogs that are just full of, honestly, parasite and worms and etc. So I would say a clean house, a clean biodome is number one, because you want to make sure that you are minimizing the exposure to a lot of these opportunist type of bacteria. So that would be number one. And of course, the research came out a few years ago that the worst biodome household is mom, dad, child, cat, and dog. So from there, I would say my second point on the list would be the gut, digestion. If you're not able to digest due to different reasons of gut issues, medicaments, antibiotics, etc., then how are you able to absorb what you need? I'll give you a perfect example. I had a family come to me, not just one family, multiple families the past few, especially months, where the parents are on top of it, clean diet, good diet, all organic, but the child has advanced amount of decay in his mouth, so we couldn't figure out why this was happening. And the last resort was I had him do a fecal test, and they found parasites. So this little kid, as much as he was eating healthy food, organic food, the parasites in his gut were eating the food and basically giving him their poop. Now, how did this kid get parasites? Well, playing outside with the animals, sand dunes, etc., etc. So we go from the healthy home family to gut and absorption of the proper food, and at the end, of course, eating the proper food. Going to, let's say, just your regular market for food that are GMO and, they've been altered genetically, that doesn't really fit the purpose. And of course, we know a lot of autistic kids, you have to really stay on top of their diet, because as they go through their treatment protocols, they might create allergy reaction to certain food and then change within a few weeks. So a proper sort of observation needs to be done. So I would say those would be my top three things that I would pay attention to.
Right, and how important it is for the entire family to get treated for parasites usually, or check for them, because we often tend to put so much energy in focus on taking care of our child and getting them well, and moms and dads and siblings aren't getting the attention to that level and may also be carrying parasites. So you might clear a child with autism, and the next thing you know, they've got them back again, and you're thinking, why? And it's because we share saliva, we share a household, and we pass it along. So we're going to get into this in detail when we come back a little bit further. We've got to take a quick break. Stay with us. We will be right back. Well, hi, and welcome back. You are listening to Naturally Recovering Autism, and I'm your host, Karen Thomas, and we're coming to you live from the Bold Braid Media and TuneIn Radio. And we have a special guest expert, Dr. Eliza, I'm going to say your first name right, Alireza Panahpour.
Alireza, yes.
Alireza Panahpour with us today, who is a biosystemic dental specialist. And before our commercial break, we were talking about parasites and the gut issues. And now I think it's important for parents to know, okay, how do these parasites and all of these gut and digestive issues that are going on affect the mouth and the teeth? What's going on there? What's the connection?
Different levels. And number one, having, of course, parasite in the gut, as I said earlier, they basically sit in your gut. They create condominiums, parks. They're very aggressive. They're very smart. They know how to protect themselves. They know how to defend themselves. And as you eat your food, they're basically eating that food, and they just, at the end, they just give you their poop. So now you have a child that's not getting the right minerals, the right omegas, et cetera, et cetera. So what does the body do? Well, the body goes on a compensation type of a mode. So the body will rob minerals from bones, teeth, and muscles. Now, that's one part of it. We also know that pH factor, children that are very acidic, Well, this acidity allows the oral biofilm to work stronger, to work harder, to work much more aggressive. That's the second part of it. Third, we see that a lot of autistic children, due to lack of lymphatic movement, due to the stress on their body, and lack of oxygenation, they start clenching and grinding. And as this happens, they start breaking teeth, fracturing teeth, and completely disturbing the harmony of the cranium that is responsible for their breathing and lymphatic movement. So it's multifold. It's not just one thing. It's multiple things.
Right. As some of you may know, my background is craniosacral therapy, and what Dr. Panahpour is talking about is when we clench our teeth really hard, we create so much internal pressure on the bones, the cranial bones, the bones around in our head that surround the brain. And when they get out of balance, they can affect many things. Those cranial nerves affect sleep, digestion, appetite, ability to think clearly. There's so many things that can affect when those cranial bones go out. I will give a link to how to find a good craniosacral therapist too. I just want to say that right up front too. So by grinding their teeth, you're saying they're trying to create more oxygen and lymphatic movement. So what's the solution? What happens? What can we do?
Well, it's multifold. When you start clenching and grinding, what happens? The muscles of the head and neck start overworking, and these muscles start going to spasm. So in a way, that is also a chronic issue that is impinging upon the immune system. Now, as these muscles go to spasm, they get shorter, they become quite, I would say, stiff. So now they are reducing the amount of blood flow to the head and neck, and hence the lack of proper dumping of poison out of the brain and the head and neck. That's the second part of it. Third, as these muscles get tense, the lower jaw gets retruded. The upper jaw is not able to expand as it should due to growth. So as the lower jaw gets pushed backwards, well, that takes the tongue and the epiglottis back, and that cuts the airway. And also, don't let me get started on tongue tie. I'm seeing a lot of children, at least 7 out of 10 children, that are dealing with tongue tie. That's also restricting proper tongue movement as it relates to the growth and the cranium function. Unfortunately, due to the age of the children, I mean, if it was an older child, we could intervene with proper appliances to help the upper jaw keep expanding, relax the lower jaw, allow it to fall forward, and help that child to the growth. But when you're young, when you're 4, 5, 6 years old, most of these children are not able to or don't want to wear an appliance. So at that case, we try to find appliances that are basically anchored in, cemented in. So, but with that in mind, you need to have a proper active dentist or an orthodontist, because as the adult teeth come in, as the baby teeth are lost, that appliance needs to be constantly adjusted and refitted due to that growth.
Right, and there are also, I know that with especially the maxilla, the bones of the upper teeth, they really need to be able to have what's called a cranial wave. It's a natural micro movement in the skull where each bone needs to just have this very small motion. It's very important for the system. So we want to make sure too that the implant has a little bit of a give. You know of somebody who has something called a light wire appliance, is that right? Where it gives
Correct.
a little bit of motion?
Correct. Light wire appliances are very beneficial. The creator of this is Dr. Nordstrom, one of my old mentors. And I would say, and of course, since then, other people have taken that technology and come up with their own little twist. You know, at the end of the day, when you are looking for the proper dentist, you really want to make sure that they are taking the right courses, they've had enough experience in these field to be able to, work with your child. You don't want to go to someone who just took a course last week. You want someone that's been doing this for a while, because it's very multifaceted. There's a lot of things that go to it. You can't just pop an appliance in and have a nice day, I'll see you next year. No, you constantly have to follow through with these children and with the appliances.
Yeah, absolutely. And if they're it also helps the child, I'm sure, as their teeth are growing and everything, especially knowing that. So I guess I'll run into, how do you start with this? Like, if I'd like to talk about cavitations, because I mentioned them in the intro, and people want to know about that. Like, what are cavitations as well? Like, that's another thing. You need a specialized biosystemic dentist such as yourself. So how can people all over the world find, if their child is in need of this type of dentistry and this kind of work, what do they need to look for, and how can they find out how to get them assessed?
It's very, very rare for us to see a child that has cavitation. It's mostly adults.
Okay.
I would say, if I had to put a number on it, I would say probably 8 out of 10 adults out there possibly might have cavitation sites.
Okay. I'm sorry, we're going to have to take a quick break, and we'll be right back, and we will finish up with cavitation. Stay with us. We will be right back. Hi there, and welcome back to Naturally Recovering Autism. I'm your host, Karen Thomas, and we are coming to you live from the Bold Brave Media and TuneIn Radio. And before we stopped for our break there, we were talking about cavitations. We have Dr. Panahpour with us, who is a specialist in biosystemic dentistry. And Dr. Panahpour, for those listening, many people don't even know what a cavitation is. Could you maybe give us a little bit of background on what a cavitation is, and how issues in the mouth can be treated, a little bit more naturally with less invasion, because our kids already have so many toxins and a congested liver that it's hard to want to put more things into their body, especially anesthesias, et cetera. So can you just give us some background there?
Sure. It's quite rare for us to see cavitations in young children. My concern has always been with the parents. Cavitations are basically areas in our upper or lower jaw that either there's been some faulty extraction sites. For example, you had a wisdom tooth, it was infected, you had the wisdom tooth removed, the proper protocol was not followed, remnants of the tooth were not removed, the infection that was there was not removed. The dentist basically followed what he was taught at dental school, which was pop the tooth out, put some gauze, have a nice day. And because they left infection behind and remnants of the tooth behind, that area closes up, and that pocket becomes a silent inflammation, a silent infection. And when we have gone in surgically, curettage that slough, that dead bone, that diseased bone, and we've sent it to pathologists to do culture, what we've seen is pretty scary. The number of bacteria, rods, parasites, I can go on and on, that is hiding within that area is quite overwhelming. So as a parent, if you are working with your child, but you have this mouth full of, let's say, mercury, infected root canals, or these cavitation sites, well, you're constantly introducing that child to that dome, to your oral biodome. And this falls on the mom and the dad. I had a patient 2 weeks. Mom came in, brought the child, we were talking, and I could smell, that's the fact from her breath, that she was dealing with gum disease. So I asked her, when was the last time you had a cleaning done? And she said, I'm so busy with taking care of my kids and husband and my child that it's been a couple of years.
Wow.
And, I had to take a step back, and I didn't know how to approach this anymore. I just tried to explain to them that your child is a part of you. Your child is a manifestation of you. If you don't take care of your child or take care of yourself, then it becomes quite difficult to try to control, the health of that child. And of course, cavitations, I can give you a weekend lecture on this. And when I'm talking about cavitations, again, I'm talking about infections within the jawbone. And it could have been that, you had an infected root canal, the root canal was removed, but the infection was not removed. And the body basically closed and harbored that infected, that silent inflammation. So above and beyond, cavitations, root canals, tooth decay, gum disease, clenching, grinding, TMJ issues, they all have one thing in common. Above and beyond the ripple effect that they cause on one body system, they all have one thing in common. They're all a chronic inflammation on your immune system. We know that 90%, close to 90% of all of our autoimmune issues that we're dealing with, diabetes, GI disorders, etc., they're all due to chronic inflammation. So my job has been to recognize, seek, and offer different modalities for our patients to get better, to get stronger, and to have these infections basically removed out of their body with proper pre and post protocol. So it really falls on the parents more than the children. Yeah.
So once the parents are taking care of themselves as well, there are a lot of kids who do have a lot of problems with cavities. Like, we've already said that the minerals have been depleted from their teeth and bones because their gut's not working well, and we need to restore the gut health, et cetera. But once they do have all of these cavities, now they're in a state where the parents have to do something. So what are the more natural options? I think that would be something that people would want to know, like, okay, so how do I get my child assessed? I know you have a very specialized type of x-ray system that you use, and that you can even see people from all around the world via Skype or an initial consultation, at least, to be able to say, okay, I see what this x-ray says, this is what's going on, and then from there they can know if they need to proceed and how to proceed. I think knowing what naturally can be done and how the least amount of invasion possible when you're going to take your child, especially a child with immune difficulties, going to a dentist. Anesthesia can be really challenging. So you have some offer there, some things that you can share with us?
I would say, first, it's all about prevention. Prevention. If at a very young age, if you start seeing any dark spot, brown spots on your children's teeth, and of course you want to make sure that you create this little sort of a program that you, dad, brother, you all brush your teeth together, you all kind of floss together. So that would be number one. Taking care of the oral cavity, brushing and flossing is number one. And it's interesting enough, not many people even know how to do it. They go move their toothbrush up and down a little bit, and that's it, I just brush my teeth. No. So we take ample time in teaching the parents so they can teach their child at home how to brush, floss, and even do it for them. So that's number one. And as you know, dealing with children that are autistic or within the spectrum is not as easy, just because of the challenge in communication with that child.
And I'm sorry, we have to take a quick break. Everybody stay with us. We will be right back. This is really important information, so please hold on. We'll be right back after this break. Hi, everybody, and welcome back to Naturally Recovering Autism. I'm your host, Karen Thomas, and we are coming to you from the Bold Brave Media. And we have Dr. Panahpour with us today, a biosystemic dentist specialist. And we were talking about actually the way you can best prevent tooth decay in the future and what can be done on the more natural level. So, Dr. Panahpour, could you go ahead and continue with what you were discussing before our break?
Sure. As I shared, number one is proper brushing, flossing for that child, for the parents, and as a family. You got to make it fun. You got to be thorough when you're doing this. Also, we are able to use, for example, if we see a child that has a very acidic mouth, well, what we do is we introduce certain tooth powders that are help to adjust that pH, alkaline that pH. There are mineral tablets available that we can, like a little candy, that we can give that child so that at least the oral flora would have minerals in it. So I would say that would be number one. You need a good hygienist that could work with that child. Also, what we do, for example, is we take a little bit of the bacteria that's developing on the tooth. We look at under the microscope and see what the child is dealing with. If there's any parasites, if there's any, what type of bacteria, rods, spinning rods, you name it.
Right,
so
the biofilm, like how much
one.
biofilm,
And
I know that Lyme is very common, and Lyme hides inside of parasites.
I'm sorry?
That Lyme hides inside of parasites, and so you can have Lyme and parasites in the mouth. You can have strong biofilm. So you have like a swab or some type of a way to check the mouth for that?
Correct. We have different equipment. There's like swab. You can run it by the teeth and see what type of a content of biofilm that the child is dealing with. Of course, we also know, as you said, Lyme hides within parasite, Lyme hides within biofilm as well. So again, keeping a clean oral cavity, brushing, flossing, toothpaste powders, etc., is number one. Number two, you should really keep an eye on your child's teeth. If you start seeing little black spots, little brown spots, well, that could be a start of a decay. So when we get our parents that bring their child, there are different modalities. For example, ozone trays have been really helpful for us. These are models we take, we send it out to the laboratory, they make us these ozone trays where the child comes in, sits for 20 minutes, 11 minutes upper jaw, 11 minutes lower jaw, these little trays go into the mouth, ozone goes in one end, sealed, and gets sucked in the other. So basically every tooth now is getting bathed in this ozone gas. And we know that ozone oxidizes biofilm. Again, that becomes a more preventive measure. So at the end, depending on the practitioner, there has to be a rapport between a child and the dentist and the staff. We try to use air abrasion, less invasive method instead of using a drill, etc., for that child. But you also need to consider that when you have a child that comes in with very, very aggressive decay, never been to a dentist before, no oral hygiene, it becomes very difficult to make sure that child is able to sit in the chair for 20, 30 minutes and for us to be able to do the work that we do. So I do see children that come here, mouth full of cavity. There is no way that that child will sit even for 2 minutes in a dental chair. So our options are very, very limited when it comes to that stage. And of course, what's the other, how could we remedy this? Again, is anesthesia, low conscious sedation, which I'm not a big fan, but am I going to have my little patient lose all their teeth and get baby root canals, then deal with the consequences of conscious sedation and help the body to reboot again? You see what I'm saying? It's a very hard decision here.
Mm-hmm. Mm-hmm. So you just deal with that individually. Like you have to go with the child's, the level of the infections and diseases, what you have going on, and then the child's level of willingness.
The psyche of the patient and the parents.
Right.
You know, of course, older children you can communicate better, you can create this beautiful rapport. But when you have a 3-year-old, 4-year-old that comes in that just has a mouth full of cavities, you can smell gum disease on the parent's mouth. You can see the number of possible root canals and mercury they have in their mouth. it really becomes difficult to try to shift that things around because it has to be done as a family, not just that child.
Right. I think it's probably important to mention here too. We talked about it earlier in the show, but how especially a woman before she ever conceives should really be taking care of her own hygiene and clearing her mouth of any infections and having things checked, because in utero we pass so much to the baby, especially mercury amalgam fillings. The baby becomes somewhat of a conduit, especially with that firstborn child, to kind of release all the toxins in the system too. So we see a lot of problems there. So I think it's important for parents to take care of themselves before they even conceive, because then of course you can end up with more and more problems with the children that you have.
And also biofilm, we know through research also that biofilm does pass from the mom to the baby.
Let's explain biofilm just briefly for those
young
who don't
women
know.
that come to my office, and basically they're like, well, I want to get my mercuries out, I want to get my root canals out, and I want to have a baby in 2 weeks.
We're going to take a quick break. I'm sure everybody's hanging on their seat like, what do we do? Okay.
Everything has to happen in stages.
We will be right back. Stay with us. Hi, and welcome back to Naturally Recovering Autism. I'm your host, Karen Thomas, and we're coming to you live from Bold Brave Media and TuneIn Radio. We have with us Dr. Panahpour, who is a biosystemic dental specialist, and we were talking about biofilm, which we're going to give you a little bit of background on, but the importance of what to do for yourself and your children, but especially, moms before you conceive, what you can do, and then when you have children, what you can do for prevention. So we left off on a little bit of talking about biofilm, or explaining to people what that is. So would you mind continuing with that and then moving into the rest of it, Dr. Panahpour?
Sure. What we thought in the early 90s that, our oral saliva, oral cavity, the research has indicated that at any time we're dealing with over 350 different types of bacteria, some good, some bad. This is what the whole research also started on. The bacteria that basically live in our saliva oral cavity have been also found in heart issues, in cancer cells, et cetera. Of course, 20 years later, now the research is telling us that, it's actually over 2,000 different types of bacteria, fungus, and virus that all live together in these colonies called biofilm. Biofilm is an anaerobic type entity, so it doesn't need oxygen to live. That's why these biofilm love to hide in areas that there's lack of blood flow, hence infections in the jaw, or areas, tissues, or cells that are diseased and are not getting enough oxygen. So again, these biofilm, when I talk about healthy home living, we have to work very hard of minimizing that exposure to the household as much as possible. Don't have your kids running outside with their shoes, and all in the streets is all dog poo, and then run home and run on the carpet, jump on the couch, jump on their bed. You got to make sure they take their shoes off, etc. So it really starts family, home. From there, of course, is nutrition. As a family, you can't have a dad eat a hamburger where the child can't eat a hamburger, or because they can't eat meat, or etc. So you got to, really cut this up in different divisions. And lastly, even though if you see pearly whites, you don't see any brown spots on your child's teeth, take him to a dentist earlier. Let him be introduced to that environment. Create that to be a little fun for him, because if there's something hiding, it's better to catch it early than catch it later. I am shocked, I am surprised when a child comes in, mouth full of cavities, and the parents have done nothing about it for the past year. They've seen it, they've recognized it, they got on the internet, and someone said, put some, some vegetable, and it will make the cavity go away. No, I'm sorry, it's not that simple. So you have to really stay on top of it. Don't wait till the poop hits the fan. Get in there early, be proactive, create that rapport with your dentist, because when that child does get a cavity, God forbid, there's a place he recognizes, there's a place he's been before, maybe have the older brother or older sister get a cleaning done, have the little guy, the little young lady watch the older brother get a cleaning done, make it fun. So again, it's all about preventive. Don't wait till it's too late, because at that time, certain drastic measures have to happen. If I can't get a child to sit in my chair so I can use my non-invasive methods, air abrasion, ozone, what have you, there's really nothing I can do for that child now. Does that make sense?
Yeah. And a little scary too, because that really has to be taken care of. I mean, you can't just keep letting it go further. So, somebody's got to do something.
The other option would be either have the tooth extracted, baby tooth, and we know that baby tooth are there for a reason. Baby tooth are there to help the expansion, the growth of the upper and lower jaw, and also to maintain the proper space for the adult teeth to come in. So child gets a tooth extracted, now they're going to have issues with the jaw. I mean, again, it's a ripple effect. So
Right.
Be proactive. Get your child into the dentist as early as 2 years old if you have to.
And you do a specialized type of X-ray. I know it's a Carestream cone beam 3D X-ray. This is not your typical X-ray that you get at any general dentist. And correct me if I'm wrong, but that regular dentists will often miss some of these cavitations or hidden pieces as well in people. So it's better to get this specialized type of X-ray and go to somebody such as yourself. And we will definitely link to Dr. Panahpour's site and everything we've discussed here on the page at naturallyrecoveringautism.com under Biosystemic Dentistry. But the Carestream X-ray, can we lead people to possibly getting that done anywhere in the world, and then going to your being able to have you evaluate for them, and then from there they can be led to maybe what else they can do or who they could see near them?
Sure. Basically, in your normal settings at a dental office, you either have the good old-fashioned X-rays, and these X-rays are basically a two-dimensional picture of you, a three-dimensional structure. So cavities can and because of that, tooth decay, infections can always be hiding or get overshadowed. Now, that two-dimensional picture could be digital, which we're talking about almost 90% less radiation, which is very important for me and my patients. So that's the first part. Second part is the cone beam, as we talked about, which is a three-dimensional picture of you, a three-dimensional structure. So now we're able to see infections within the jaw much more clear, and we can actually find them. I can't tell you how many times I've had patients that have came to me, my naturopath told me, or my functional medical doctor told me, this root canal is causing my illness, or is putting a burden on what I'm trying to, as I'm trying to get better from my illness. I went to my endodontist or my doctor, they took a picture, they said, everything is okay, everything looks perfect. Mm-hmm. And of course, they come to us, I take a 3D scan, and you can easily see these infections hiding behind the root or different structures that you can't see on that two-dimensional picture. So the reason I'm not trying to advertise for the company or anything like that, there's a lot of different cone beam technologies out there. The reason I like Carestream the best is because that it's got a certain function that we're able to also measure density of your teeth and your jawbone. And these areas that are, let's say, cavitation sites or infections in the jaw, we see high number of negative density. So
Okay,
negative
we're going to have
density
to take
now
a
means
quick break,
no
and then we
blood.
can finish up with this when we come back, so that people know the difference, because a lot
Okay.
of people getting probably x-rays thinking that they have the information they need and they don't. So stay with us. We can take a quick break. We'll be right back. Hi, everybody, and welcome back to Naturally Recovering Autism. I'm your host, Karen Thomas, and we're coming to you live from the Bold Brave Media and TuneIn Radio. And we have a biosystemic dentist specialist, Dr. Panahpour, with us, and before the break, we're talking about the very specific type of Carestream cone beam 3D x-rays that are necessary to be able to find a lot of the hidden problems that don't come up in regular x-rays. So, Dr. Panahpour, you were talking about it measures various things that others don't?
Yes, it has a special function that we're able to look at density of your jawbone in different areas of the jaw. And of course, when you find these cavitations, they're like very high negative density, so which means that there is no blood flow there. If there's no blood flow, there's no oxygen. If there's no oxygen, that becomes a little biodome for bacteria, fungus, virus, rods, parasites to live in. So that's why the 3D is so important when you're dealing with. And of course, we also want to see how big they are, how extensive they are, if they're close to the nerve, to an artery, etc. So I would never do any kind of cavitation surgery or removal of an infected root canal unless I do have a 3D cone beam in front of me.
Because that gives you the further information on it. I know you have some case studies that you've shown too that I think people might be interested in. You have your book is called The Good Dentist. Is that correct?
Correct. It's available on Kindle and Apple Book, what have you. But also we are working on a campaign to actually get hard copies. So I am in the process of finding out how many trees for how many books. Then we're going to create a campaign where we're going to go out into the woods and we're going to plant 3 times the amount of that tree. With that, I feel better having a hard book, paperback book available
I love that idea.
For the public.
Right.
We do also post regularly on Facebook. I have, Dr. Ali Reza Panahpour. Also, my website is www.systemicdentist.com. We do also do promotions for our 3D scan, mercury removals, etc. As you know, the European Union completely just banned mercury fillings further than what they had done in 1993, where Sweden was the first, and then Belgium, Finland, etc. So we're really excited about that. So we do run a lot of information through our Facebook to reach our audience, our patients, and possible potential new patients in the future. One thing I do want to say is that, at the end of the day, every equipment, every theory, every procedure, every protocol is as good as its operator. So just because you have the most expensive equipment doesn't mean you know what you're doing. 2, make sure that you ask for your dentist CV, what classes they've taken, how active they are in the community. You don't want to go to someone have a surgery done when the last time they took a class in surgery, and I'm not talking about a 1-hour course on how to do surgery. I'm talking about 3-4 day course where you have didactic, clinicals, that sort of thing, really advanced courses. When I get a child that comes here, mouthful of cavities, and the parents have not been proactive, I'll be very honest with you, it's very difficult to work with that patient. It's very difficult to try to turn things around at that stage because you have teeth that are either dead or are dying.
So we're going to have to wrap up. This has been so helpful, Dr. Panahpour. I am going to link to everything that we discussed, Dr. Panahpour cites, the X-ray types that we were talking about, everything at naturallyrecoveringautism.com. On the page, it'll say you can search in the search bar in the blog. You can just put our podcast. You can put in biosystemic dentistry or dentistry. It'll pop right up. Again, naturallyrecoveringautism.com. So you can find out more about where you can take your child and everything that we've just discussed here and all of Dr. Panahpour's links. Thank you so much, Dr. Panahpour, for joining us. This is Karen Thomas from Naturally Recovering Autism. And come back, join us next week. We'll have more great information for you to help you with your children. Thanks again, Dr. Panahpour.